Adjusting to parenthood or having a new baby around can be really difficult. So today we want to talk to you about our 6-step plan to help maximize your mental health during the postpartum period. I'm Dr. Nichelle Haynes.
I'm Dr. Kristen Lassiter.
And we're medical mamas. This is your place for evidence-based information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes like around pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
So we compiled 6 steps to help you plan for your mental health in the postpartum period because we know how important mental health is during this time. And so we wanted to compile them into something that felt really like doable, right? So like 6 steps, and there are things within these steps that you could do.
Yeah.
Right.
So the first one, and probably the most important one, is planning out your sleep. And I know this sounds crazy with a newborn because sleep is so unpredictable, but that's why it's important to plan out who's going to be doing what so that everybody can get good sleep.
Mm-hmm. So I talk to my patients about the ideal situation being having 5 hours of sleep in a row and 7 hours of sleep in a 24-hour period. And I always say, I know your baby's not in on this plan. I know your baby's like actively trying to help you not achieve this goal. And there's no judgment if you're not able to achieve it right away. But just this is the thing we're trying to aim for. And if we do even better than that, great. But if we can't get to that point right away, it's totally understandable. Your baby has a lot of needs, especially at nighttime. But we're just trying to reach for this as close as possible. So what are like some things that you talk to your patients about? And I want to like kind of hear what you have to say about how to kind of achieve this.
Yeah. So, I mean, most babies, especially in the beginning or at some point in that first like month of life are going to wake up like every 1 to 2 hours to eat. And they're just going to wake up at random times and there won't be a schedule. And getting that 4 to 5 hours of uninterrupted sleep is so important for your brain. And getting that total like 7 to 8 hours is also really important for your brain. And brain health means mental health. So you're, protecting your mental health by getting this good sleep. So I tell my patients, breastfeeding I know is important for a lot of people. And so if that's your main priority, definitely trying to get that established in the first like month or two. But then after that, or if you can do it before then, having somebody else take the time to feed your baby when you're on your 5-hour break shift, right? So a lot of times I tell my patients to split up the night. One person take the first half of the night, the second person take the second half of the night. That way each person can get a good 5 hours of uninterrupted sleep. And whoever is on is responsible for changing the baby, feeding the baby, doing all that, even like sleeping in the room with the baby while the other person can get their own room entirely, because we also know how noisy babies are when they sleep. They can make all these like grunting dinosaur noises.
Dinosaur noises, that's what I say too.
Yes. And it's impossible to sleep when you're in the room.
All the time, yes. So I also talk about if you want to directly feed from the breast, that especially at the very beginning, we can kind of have like a zone defense, right? We can have mom feed and then support person can do the burping, the diapering, the getting baby back to sleep. And that can extend the period of time that mom can get some sleep. There might be, some just nuanced things that work better for some people versus others. But if you are having your feeding established, or if you could pump during the day or do an extra pumping session to give breast milk at nighttime, whatever you need to do to support your mental health, your baby's going to be fine. If they use a little bit of formula, if they have to use a bottle every now and then, it's going to be totally fine. Of course, talk to your pediatrician about what your baby's needs are, but really prioritizing that sleep should be like number one thing that we are trying to do. First, we're keeping baby alive, and then we're getting our sleep.
And a lot of times I will have my patients have other people come in to help with like the sleep part, right? So it doesn't have to be just you and your partner. It could be grandma or grandpa, or maybe a night nurse or a postpartum doula or
cousin from Minnesota.
Yeah,
Or, you know,
whoever.
else.
Just whoever, like, and plan that out ahead of time before your, postpartum time, so that you kind of have a list of like, okay, who's going to be helping this week and who's going to be helping next week. And then also, I think for a lot of us moms, we kind of imagine like, okay, like during the day while I'm on maternity leave, I'm going to get a bunch of stuff done. Like I'm going to be able to like rearrange this pantry, or no, just plan to be sleeping. When your baby's sleeping, just give yourself time to rest and close your eyes and sleep, because you will probably be sleep deprived and not getting enough sleep at night.
Yes, that's number one. We spend the most time talking about that. Move on to number two.
Number 2.
Okay, I think a really important component of taking care of your mental health in the postpartum period is having time for yourself and connected time with, your people.
Yeah. Yeah, so making sure that you plan that out ahead of time. Okay, like who's going to be able to be there to help watch the baby during the day, so that I can get my own time to myself, because you need breaks. Like you cannot take care of another human being 24/7 without having breaks of your own. And hence the phrase, it takes a village, because we're not meant to do this by ourselves.
Right. There's lots of creative ways to do this, right? So we know there's like a number of things that need to be done for the house. There's a number of things that need to be done for the baby. Let's outsource some of that, right? So your time for yourself can be, I hired, a high school kid to come and undo the dishwasher and put away the laundry. So I have a full hour to myself to take care of, myself, whether it's showering, getting a little bit of journaling time in, or meditation, or whatever the thing is that you can kind of find creative ways to create that time for yourself.
Yeah. And then our third plan or step is to really focus on nutrition and also meal planning, right? Like you're in the postpartum period, it's really hard to go grocery shopping. It's hard to leave the house and get food. It's hard to actually make food. So kind of planning that out ahead of time. A lot of people do like meal trains, but also just making sure that you're getting like good, nutritious food that is nurturing to your body and your brain.
Right. I mean, yeah. Eat what you can and support your body the best way that you can. Some people even put on their registry like the meal delivery service gift cards, and you can utilize those for, some of your breakfasts or, dinners or whatever. So consider doing that to make sure that you have good nutrition, setting up a meal train, prepping some meals, some freezer meals beforehand, so you're just putting them in the oven can be really helpful. So this is part of the planning that you do before to support your mental health after. Okay, number 4, support, which we kind of like touched on a little bit here and there, right? You have support with your sleep people. You have support with, maybe someone coming in to give you time for yourself. You have support with getting food. But really, this is like connected time as well, right? You're like, able to see your mom friends or hang out with so-and-so, or just have a text thread that you can be like, geez, I'm so tired, right? Or like, this is really hard. I'm not really liking this component of it, right? So just finding creative ways to get support for yourself so you don't feel so lonely, because it can be a really important aspect of transitioning to parenthood, can feel really lonely.
Yeah, I hear that all the time from patients, even if they're doing really well in terms of their mental health. A lot of people complain of feeling lonely in the postpartum time, because it's just you and this little baby who in the beginning just lays there and doesn't interact with you. Just yells at you all the time.
I have some people who plan visits with me just so they have another adult to talk to.
Yeah, and that's a good point too. Making sure that you have like a therapist or somebody who is there to talk to in case you need it, especially if you've had a history of depression or anxiety in the past. Having that mental health support with a therapist is also really important.
Yeah, so emotional support, social support, like kind of like task, sort of like household support, sleep support, all those things. How to think through those categories.
And childcare, like if this is your second or third baby or fourth or whatever, making sure that you have somebody else who can help watch the other kids or somebody who can watch the baby so that you can spend time with the other kids too. That's really important.
Oh yeah, great point. Totally. This is not everyone's first baby.
Yeah.
Yeah. Okay, so number 5 would be movement. Of course, you want to take this slow. You want to make sure that you're making sure your body is healed. If you were the one to give birth, that you're on board with your medical team, that they're involved in this process, but just, taking a walk, getting your body moving in whatever way feels good for you can be really great for your mental health. And then as things progress, maybe you're, adding in a little bit of yoga, or you're stretching, or, you're doing your C-section scar care, or just kind of getting reacquainted with your body the new way that it is. And then over time, getting more intense with your movement as you move forward.
Yeah. Exercise is so important, or positive body movement. And there's actually even programs out there to help you kind of get back into exercising, because a lot of times your core is just shot from being so hyperextended for that long. And so even, starting with simple breathing exercises, things to kind of help strengthen your core and get things, kind of feeling normal again. And that's just really important for your sense of self and taking care of yourself, and modeling for your kids how to take care of yourself too.
And your brain.
Yeah, it's so important for your brain.
Okay, so number 6, and one of the things that we think is really important, is educating yourself about perinatal mood and anxiety disorders, the things that can happen, including postpartum psychosis after delivery. You want to educate yourself about those prior to delivery, right? So you know what to look for. And this includes your support people too, right? Sometimes when we feel bad, are the last ones to recognize it or know it. The other people can see it first, is to kind of know what those things look like, know what to watch for, and know how to move forward if you're noticing that you need some help.
I usually have my patients bring in a partner if they can, to kind of talk about what are the signs and symptoms to look out for postpartum. And I think then it's just really important to kind of have an idea of that before you go into the postpartum, because once you're in it, it's hard to recognize what's happening. What day is what.
And don't add anything to your plate for the postpartum period, right? Like, this is something that can happen in those months that you are pregnant or planning for a baby, that if you can do it now, you have that information, you can retain it, and then you can use it later on. So don't add anything to yourself postpartum.
Yeah.
And I really will say that, especially here in America, the education that exists, when you're leaving the hospital, is really skim to none. So we have videos on what perinatal mood and anxiety disorders look like. We'll link them here in the show notes. That sounds fancy. The show notes, or in the bio, or whatever it's called, the description, for you to watch and accomplish that one here now, and make sure that your team, your OBGYN, your pediatrician, all of these people are helping you look for those things, and you kind of have the discussion. This is what my depression looks like. This is what I anticipate might happen. Maybe we need extra visits, something like that. So planning ahead for mood and anxiety disorders so that you can have treatment, which we know is really beneficial too.
Yeah. So really take the time to kind of follow these steps and plan out your postpartum period. It will just make it so much better for your mental health in the postpartum, which we think is so important, and research says is so important, because your mental health and the mental health of your partner is really influential on your baby's growth and their development, their emotional, social learning, their intellectual learning, all that good stuff. It all is tied in with how you're doing. So make sure to take care of yourself.
Yeah, we know you want what's best for your baby, and what's best for your baby is that you're well. So follow these steps, take care of yourself. Thank you so much for being here. Please like, comment, subscribe. We'll see you soon.
Bye.